most famous physical therapist on the internet.
Hi folks, Brad Heineck, physical therapist.
Hi, I'm Chris the pharmacist.
And today we're going to talk about blood pressure. How high is too high, possibly life-threatening, and top 3 options to correct it safely. But before we get any farther, we want to talk about some platforms that we're on.
You bet.
And if you go to bobandbrad.com, we have a giveaway.
Woo.
And we've got it right here. We'll talk about it in just a little bit. But go to there, go to the giveaway section. You can go to Facebook. Go to the top of the page. It'll get you to the giveaway. And if you want a short version, 60 seconds, go to the Twitter, the Instagram, and the TikTok platform, and we're there if you cannot stand us for more than 60 seconds. Now, the giveaway is a Sleepovation mattress, and they have 700 tiny mattresses. I love mine. It's changed my life sleeping in the last 2 years. They have a nice dual cover mattress, and again, the 700 tiny mattresses, which makes you feel so good. But let's get on with blood pressure, Chris.
All right, here we go.
Any questions about the mattress, Chris, before we go on any further?
No, it looks fantastic.
I love it. You can lay on it later.
All right.
Anyways, let's get to this blood pressure, because this is a serious topic. I've dealt with borderline blood pressure myself and been able to successfully treat it without medications. But we need to know the big thing. Blood pressure. What is too high and what's not too high? But let's go back. There's 2 numbers with blood pressure. Let's kind of clarify this. It's systolic, diastolic.
Yeah, you got systolic, diastolic, top and bottom, so kind of whatever way is easier for you to remember. But basically, the systolic is the first number that we see up here, that 120/80, and that's a normal blood pressure. But that one is when the heart beats. So think of your heart as a pump.
Yep.
As soon as it presses, that pressure that they feel in the vessels, that's what that top number is measuring.
So that's the big push of the heart.
That's the big push of the heart. And then when the heart is relaxed and it's filling back up with blood, that's what the diastolic number is measuring. So that's what that 80 is right there. So,
and that's, we don't need to know this, but it's in millimeters. That's the technical.
Millimeters of mercury is how they recognize it.
I always remember diastolic, D for down. So that's the lower number.
Yeah, that's an easy way to remember it.
But you really don't need to know that. But you do need to know the numbers and where you're safe and where you need to be concerned. And then, of course, the extreme.
Absolutely.
So
absolutely.
We've got the chart here. Chris made this really nice chart. Let's start out with the normal blood pressure that is acceptable and you're safe.
Yep, absolutely. Everybody, we'd like to see that 120/80. I think that's just a reasonable standard number that the American Heart Association, American Cardiology Association, they all kind of recognize that. And it can be lower, it can be a little bit higher.
Yep.
And so and as we progress through the whole chain here,
right.
So that's where we want to strive for. And when people are healthy, that's what we see.
Now we're talking about high blood pressure, sometimes called hypertension. Hypertension. Is there any other terms you might hear?
No, I think, high blood pressure and hypertension are used interchangeably.
Yep.
So I think that, most physicians and nurse practitioners and PAs would probably say hypertension. But for you and me, blood pressure, high blood pressure.
Yep. Okay, so let's start out. We got normal, and then these are actual classifications.
Yep.
Okay, that are recognized. And the first one says elevated. So that's if you're just a little over normal, but
a little bit over normal.
It's not dangerous yet.
Not dangerous yet, but it's a sign of things to come.
Okay.
So we do want to make sure that we're paying attention. When you go into your doctor's office and all of a sudden these type of numbers pop up, doctors will do a couple different things. They're going to measure it on a couple different occasions.
Sure.
They might measure both arms just to kind of see what's going on, because there's a thing called lab coat syndrome, which suddenly...
Yeah, I always call it white coat
syndrome. So basically when somebody walks in the room and they're in a very formal looking doctor, and I'll say, oh my gosh, he's going to figure out that something's wrong with me. And people do get tense, and it does raise your blood pressure. It's a known fact, unfortunately.
Sure. And it's just a natural thing.
Yep, it's natural. Everybody, a lot of us experience that, so it's just something. So they want to take a couple different, and they'll even actually, maybe at the end of the appointment, they'll strap you up in a cuff again, kind of catch you off guard, so you're more relaxed because you've been talking about some things, and I'll say, oh, look at that, it's normal.
Yep.
So sometimes it's just due to the stress. Maybe you walked up a couple flights of stairs to get to the office, so
so anyways, can you read this well, Mike? Okay. Then we'll go to stage 1.
Stage 1.
So that's another
the first
step in the wrong direction.
Yep, another step in the wrong direction. And what I guess I didn't preface it, in 2017 they changed all these numbers.
2017.
2017.
3 years ago.
Yep. So it used to be the old norm before stage 1. It used to be just 140 over 90 was like, okay, that's bad. Well, they decided to add this designation, this 130 over 39, over 80 to 89, and that's stage 1 hypertension or stage 1 blood pressure.
Right.
And so it's kind of that first stage that when your doctor gets a couple of measurements, because they aren't going to put you on blood medication right away. They're gonna look at it and observe it, and they might have you come back in 3 or 4 weeks and do it again, and all of a sudden, it's still there. So at this point, the doctor's gonna, and a lot of times they probably would have had this discussion about your lifestyle changes and things of that nature. What can we do to affect this? And we'll move on to that. But.
Okay, we'll talk about what you can do without.
Yep.
So you can avoid medication.
Yes.
Okay.
Yes, and that's this group I think is a really good one to focus on when we're in that point.
Right.
And that's kind of the hallmark of what most cardiologists and physicians are going to talk to their patients about.
But you could come in, maybe you progress to stage 2, or maybe you came in before that, and all of a sudden you see these numbers, 140 over 90.
Yep.
Okay, so that. Things are starting to your eyes are open a little bit. At least the doctor is.
Oh yeah, you got 24 million Americans in this group right here. So stage
24 million. So what percentage is that?
That's a lot. It's probably right in that 30% range.
Okay,
so,
are touching up into that
of adults.
Yep. Mm-hmm.
Yep. So it's something, and this is definitely going to require medication. This is stage 2. So this is the one where probably we're still going to stress the lifestyle changes, but there's definitely going to be medications added, and they might even add medication depending upon your circumstances, genetics, cardiac risk factors. So there's a lot of other things that go into this, but for the
factors.
Yeah, for the ease of simplicity, this is something that your doctor will probably at one point you're going to be on medication to try and help to control that and keep you safe.
Right, because you might say, well, can I do this with diet and exercise? But you're saying maybe you can, but you're putting yourself at risk.
Yeah, I mean, you're going to have to, your doctor's going to have to be on board with your exercise plan. And keep in mind, exercise can be something as simple as a 30-minute walk. Mm-hmm. So, I mean, that's enough. If we're you got to raise your breath a little bit and get that heart rate pumping. And I think that's going to do a nice job of helping. And it's exercise, diet are pillars of treating hypertension at any one of these ranges.
Sure.
So we have to make sure that when we're using that, and your doctor is going to be paramount. He's, like I've said before in other videos, he's your quarterback. So you're the team, he's the quarterback, and basically you're going to work together to try and make sure that we can bring it back towards this level.
Right. So let's say, because a lot of people may be living at this
and don't even know
it. And if that goes on for a number of years, that's actually causing problems with your arteries, which can lead into the strokes, other
you name it,
stroke,
heart attack,
problems.
vascular dementia, kidney problems, organ failure, vision problems. I mean, it's a big umbrella that hypertension. All of a sudden, you hear hypertension, and everything underneath that umbrella kind of fills in. So there's lots of other things that can happen.
All these diagnoses that
are associated with it. I mean,
so if you can correct that higher blood pressure early, that doesn't eliminate, but reduces your risk for all these other problems that can come down the road.
Correct. And just to kind of put that in perspective, I mean, you get 3 million Americans each year are getting diagnosed with high blood pressure or hypertension. So that's a lot of people.
So that means they're at stage 2?
Not necessarily. It could be 1, 2. I mean, but they're going to call it hypertension. They're 1 and 2. So that's 3 million patients a year.
Okay.
We lose 500,000 to hypertension related.
So you're saying 500 people
500,000. 500,000.
500,000 people die every year worldwide or in the United States?
United States of America.
So 500,000 people die as a result of hypertension or associated causes.
Correct. Yep, hypertension with associated causes.
Okay, so that could be a stroke. It could be vascular problems, heart attack.
Exactly. Okay. Exactly. Right. So it's all encompassing. We have to be careful.
So now we're getting to that part of the title, life-threatening.
Yep.
So let's go to we got it in red,
hypertensive crisis.
And that's officially what they call it?
Yep, that's the big word and it's nothing to sneeze at. This is a big deal. So if you are testing your blood pressure at home and you're popping in with a 180 over 120, it's kind of like Monopoly. You go directly to jail, you go directly to the hospital. So you can certainly call your doctor if you feel it's necessary.
Would that mean an emergency room or urgent care?
I would say an emergency room probably at this point, just because they're going to be the ones that are going to decide. I mean, you got to this reason you got here for a reason. We don't know why. And if it goes sideways, Yeah, a stroke, heart attack could be imminent. So it's something that we just don't want to
Sure.
mess around with.
You know, and I always think of this as a therapist. I've worked with a lot of people with strokes. You know,
Yep.
I don't work with people with heart attacks except for after the fact if they're rehabbing. But a stroke, I see them very quickly after the event, and it makes so much sense because what happened is the pressure is getting so high,
Yep.
it bursts through the arteries, the vessels in the blood vessels in the
Yep.
brain, starving the brain of blood and oxygen, and then you have a stroke, and you know it's a life changing
It is.
issue,
And it does.
and it
there's
could
a
be
ripple effect.
fatal. You know,
Yep.
too.
Exactly.
So there's no joke about high blood pressure. When you get
No.
this high, oftentimes people are feeling symptoms like headaches. There's some other things that.
Well, actually, and the scary thing about all of this,
Yep.
more often than not, people don't feel anything. And that's the scariest part about this aspect. And that's why they call, blood pressure the silent killer. So when you have high blood pressure, it's something you just may not even notice. And you'll have people go for years. Let's say they had an appointment in their 20s and you're healthy as a horse and you're feeling
Sure.
good. And all of a sudden they have, they just haven't been to a doctor in years, which is oftentimes the case.
Sure.
All of a sudden they're 45 years old. They go in and see the doctor and they're like, oh my gosh, you're 170 over, 98. What's going on? Well, I don't know. I feel great.
Yeah.
And all of a sudden it becomes this type of issue. And there's lots of long discussions at that appointment to how can we get this better
Sure.
and keep you safe?
Sure. And so I think nowadays, and this has been going on for years actually, people are taking their own blood pressure at home.
Yes.
But it's easier now. I remember years ago with my father, he had high blood pressure, and he'd be pumping that thing up around his arm and measuring his own at
Yep.
home
Yep.
To monitor. But now you just put the cuff on,
Yeah.
push the button.
Push a button. It's
right.
really easy. So, and you always want to make sure too, when you get a blood pressure cuff, unless you have an absolute, problem where you can't get the cuff around your arm, you never want to do the wrist one. The wrist one, basically these two bones in your arm, you have one over here and one over here.
Yep.
It does not allow it to squeeze properly to give
Sure.
you a good, accurate
Yeah.
measure of blood pressure.
Yeah.
But when you get it around the arm, you get that good, accurate measure. And
Sure.
it's the same way in the doctor's office. They don't measure your wrist. They always measure it around your arm.
And if we're talking about this, well, we must be comprehensive with this video.
Absolutely.
If you are taking your own, same thing. My dad had one of the wrists, and the numbers weren't good.
No.
We ended up going back to this, and this was later on. This is just within the last 10 years.
Sure.
But you should take it in a consistent posture.
Perfect posture.
So you should have sitting. Well, we got the table in the
see?
way, but sitting with your knees bent at 90 with good posture, and take it on the same arm. Write it down, or
Yep.
sometimes the digital ones have a history, but if you're not comfortable with that, write it down. That's me. Write it on paper,
Yep.
so it's there, and do it in the same location, the same atmosphere.
Yeah, you always want to be consistent with it. So you always want to sit for 5 minutes. So, maybe you walked, you had some breakfast, and you're like, oh, it's time for me to do my blood pressure. So you want to sit again with both feet on the floor, like you said, perfect posture, just kind of standing there relaxing.
Relax. Yeah.
And then, wait 5 minutes and then put your cuff around your arm. And it's actually important to make sure your cuff is on your arm properly too. So depending upon the unit that you use, and I will tell you with Consumer Reports, the most widely recommended one is made by Omron. So it's a fantastic machine.
OMRON.
Yep.
Mhm.
So it's the one that I recommend routinely at work because I just can trust their accuracy.
Sure.
So it's excellent. It rates well. They're reasonable in cost.
Yep.
So, and you can get it anywhere, pharmacies, online, wherever you want to shop for something like that. But before I forget, you want to make sure there's actually, and actually the nice thing about the Omron product actually is they show you a nice little picture. They got
Sure.
a pictogram showing you how you should use it. So you're going to have your arm like this. It's going to be around your cuff and there's a little line that's the tube that goes to the unit.
Yep.
And so you just want to make sure it falls down the center of your arm.
Yep.
And then while you're relaxed, you hit the button and basically about 35, 40 seconds, you're going to get your pressure and your blood,
Sure.
and your heart rate.
Yep. All right. So we know where that really high blood pressure is. Get to the doctor right away. Let's go back in here and let's look at the second part of our title. What are the three options?
Well, basically, number one, that depending upon where you fall, it's always going to be exercise and diet, which are under that lifestyle changes. And sometimes, if we use the exercise and diet as 1 and 2, medications are probably number 3.
Sure.
So from that standpoint, but medications can easily become the primary course of treatment,
Sure.
depending upon what your doctor and you decided is best for you in your particular
Right.
case.
Do you know how many people are on blood pressure medications in the United States
Yeah,
right now?
roughly about 30 million people are on blood pressure medications right now, or at least should be. And and many of those are actually falling in that 140 over 90 range. So
Sure.
It's a large number, like
And
25%.
success rate with blood pressure medications?
25% of people on blood pressure medications are well controlled. So
Okay.
everybody else is not.
So they got to monitor it.
We need to monitor it. And so that home monitoring, I think, it's a very invaluable tool for us to utilize at home so that we kind of know where we are, and you can always fill in the gaps with your doctor and just say, hey, I did really well. And you go to the office, listen, it's up 10 points. Well, maybe it was you're just stressed out about seeing the doctor, but it helps them.
We're talking top 3, diet and exercise, but really that's they're 2 separate topics, but they fit together.
They do. And exercise is so critical because we want to get that heart rate up as long as your doctor approves you to do exercises.
Sure.
So that's one of the first things that we have to clear that hurdle before we just, it's always good to exercise. You and I are firm proponents of that. But it's something that if there's something cardiovascular in nature, you want to make sure that what you're doing is safe for you. Because if we're maybe somewhere between this or we're really super high, your doctor might want you to ease into an exercise program because too much, too soon, too fast could have some very serious consequences.
So you could escalate or even cause a problem.
Cause some serious problems.
Right. Yeah. And if you're not an exercise person historically and you don't want to go on meds and you think, oh, I'm just going to get after this right now, you better think again, and you're going to gradually, you're not going to go out and start running a marathon.
No.
You're going to start by walking.
We're going to walk. Walking is great. 30 minutes, 5 days a week, just so that you're breathing a little bit harder than usual. That's probably the easiest way to kind of determine how hard am I really working. Well, if I'm kind of taking some deep breaths, you're working hard enough. So if you're not, if it's too easy to have a conversation, you can exercise and have a perfectly good conversation. And that's probably the training range you want, but you're going to want that heart rate bumping a little bit too.
Yeah, it's not a casual look at the birds walk and stop. You're going to
a brisk walk where you're moving. Something that if it's a nice cool morning, it helps you warm up.
Now I want to mention we're going to do another video follow up on this in probably a couple of weeks, and we're going to go into more detail about diet and exercise and the medications. I do want to come up with the good news is I looked at mine in my 20s, and I was always in this range, just elevated range.
Yeah, but back then it wasn't a big deal.
Well,
we changed that in 2017.
But actually, at that point, because my dad had it, I was looking at it, and it's a little red flag for me.
Oh, it's smart.
So I started back when I was about 30 years old, I started running. I didn't like running because it's boring. I was in karate at the time. Punching and kicking people was a lot more fun.
Oh, yeah. It's always more fun.
But it wasn't aerobic enough necessarily a lot of times. So I started running. I went back to college. I needed something because sitting in a desk bored me anyways. Started running, and I dropped down 10 to 15 points on both ends.
Yep.
Dropped it down once I started running. And actually my heart rate dropped way down too, which is another benefit of cardiovascular exercise, aerobics.
Yep, exactly.
And I haven't had a problem since.
Yep.
So I think if you catch it in here and you're motivated to change your lifestyle, and then recently I've changed my diet, which I probably has helped, but I haven't had a problem anyways. So get in early, get here, and then you don't have to get to the medication. I'd forget to take them. That's the problem.
Well, and that's a big thing in my world. So
is it really?
Oh yeah, huge. 60% of people don't take their medications properly. So
they don't take them daily, or they forget, or if you need
just
to
forget, take it at the wrong time, maybe not, not consistently. Actually, we do things called adherence calls and things of that nature. Yep. So it's actually how insurance companies reimburse pharmacies actually now. So it's a big deal.
If people don't take their meds on time, then
we don't get paid.
The insurance doesn't pay the pharmacy as well.
Not as well.
Wow, that's interesting.
It's a big deal.
Yeah, so you got to make sure you call people and see if they're taking them on time?
Yeah, we do. And it's actually more with Medicare Part D patients. So this is a long sideways sidebar, and it probably puts some people to sleep.
Yeah, we're getting at the end of the video anyways, but there's a lot of things that revolve around this. So stay tuned. We're going to have another video on details of diet, exercise, and some more on meds as well. People that view this, I think, are hoping to stay away from the medication, like most people are.
Well, and exercise and diet are a huge proponent of that. And if we work at it, and if you treat yourself like your own best investment, I think it can be very doable.
Sure.
But you got to work at it. It's not just something you're just going to hop off the couch and run a marathon and I'm good. Once you stop exercising, all those good benefits that you received go away. So that's something that, it's a lifestyle change.
Sure.
Means forever.
Now, I don't know. This fits right in. We can fix just about anything.
Except a broken heart.
But we're right on there.
We're working on it. We're working on it.
All right. Very good. Take care.
Thanks, everyone.